So another question that you may get on the NCLEX exam is most important or priority or firsts. And these words will be highlighted, which is what I tried to do here, is to highlight the two words most important. So the question goes as follows. The nurse is providing discharge teachings for several clients. Which teachings are most important to provide? So the first answer choice is please stay away from salt substitutes when taking valsartan for hypertension. What you want to ask yourself is, what do I know about valsartan? And this medication belongs to an angiotensin receptor blockers, which are kind of the same as ACE inhibitors, which are your PRILs. One major complication of valsartan as well as ACE inhibitors is that they cause hyperkalemia. So when someone is taking this medication, you really have to watch their potassium. What do we know about salt substitutes? We know that salt substitutes are high in potassium. All right? And we also know that valsartan can also cause increase in potassium, which potentially can lead to hyperkalemia. Both of these together can potentially be deadly. So obviously we would want to choose this answer because we do want to let our client know that there is a high risk of hyperkalemia if the client takes salt substitutes with their valsartan medication. The second answer choice talks about a medication called ciprofloxacin, and it says it is okay to take ciprofloxacin with the aluminum antacid you are currently taking. Now again, very, very tempting because they're already taking an aluminum antacid. But it's important to remember ciprofloxacin is an antibiotic, and we also know that at least 2 hours should pass between any other medication administration for this specific class of antibiotics. Key word, taking with, is wrong because we know that 2 hours need to pass. So we're going to eliminate this answer. The third answer choice says return to the emergency room if your urine turns red-orange while taking rifampin. Let's just take a break here and let's just talk about this. When I studied my medications, I didn't go into detail focusing on things like nausea, vomiting, diarrhea, because it is kind of like a given to know that medications may cause this. However, what I did instead is focus on what I called is gold keys, is that something about a specific medication that is different and unique to that specific medication. Back to rifampin, we know that rifampin normally causes a red-orange color in the urine, and it's really harmless. So returning to the emergency room is not necessary, and so we have eliminated this answer right here. The next answer choice reads, notify the healthcare provider if you experience vision changes while taking ethambutol. And ethambutol is a medication that is used for tuberculosis. And then we know that the earliest sign of toxicity in this medication is vision changes. It's important for us to teach the patient to come back, or at least notify the healthcare provider, if they're experiencing vision changes with ethambutol. The last answer choice reads, it is normal to experience mild nausea when taking digoxin. A lot of us might see this answer as an optimal answer, again, because of the word mild. And we might say, well, he's only experiencing mild nausea, so, I guess it's normal, right? Because nausea and vomiting is kind of given when given a medication, so we have to watch for that, so I guess it's normal. Well, this is where you're falling into a trap, because if you know anything about digoxin, if you did your reading, you will know that any GI changes, I don't care if they're nausea, if they're vomiting, if they're diarrhea, if there's constipation, if it's cramps, if it's the client doesn't want to eat, lack of hunger, doesn't matter what it is. If it is a GI disturbance, it is an early sign of digoxin toxicity and must be reported and dealt with right away. It is a priority and it's most important. Will we teach the client that it is normal to experience mild nausea when taking digoxin? No, we won't. So we eliminate this answer as well. Now we're left with these two options of please stay away from salt substitutes when taking valsartan for hypertension, which is correct because you want to eliminate hyperkalemia. And another answer choice that we're left with is notify the healthcare provider if you experience vision changes while taking ethambutol. There's also another answer choice that we haven't talked about. And that is this one. You can do this. Good luck. Most important thing to remember about select all that apply questions, or SATAs as some of us like to call it, is taking your time and really understanding the question. Again, don't worry what other people are doing, what other people got. Take your time, dissect it, make sure you understand it, and spend time on these questions.